Hello, I am Dr. Trivedi, a doctor working here in this clinic. May I confirm that I am talking with Ms. Scarlett Johansson, 32 years?
Yes, Dr. Patrice.
Yes, okay. May I please know how may I address you?
Doctor, please call me Scarlett.
Okay, Ms. Scarlett, today we are going to discuss about your health issues and some further discussions about it. Are you okay with it?
Yes, Doctor.
Okay, and during our discussion, do you want anyone more to be present with you?
No, Doctor, you can discuss it with me.
Okay, that's all right, Miss Scarlett. And may I know that how are you feeling now?
Actually, Doctor, just having some recurrent episodes of this racing and pacing of my heart. I don't have any other physical problem. But actually, I am worried, Doctor, because my one of my uncle,
Yes.
he has died recently because also he had some racing and pacing attack before taking him to the hospital, and in the hospital he was diagnosed with having some heart attack, and after that he died, and I am really worried about that. Am I going to die like him?
Hello.
Yes.
Yeah. Do you have any idea about what your symptoms might be due to, or what is it?
No, Doctor, I have no idea.
Okay. Well, actually, we have. I have your reports here. Okay, and I have your reports and some test results, and regarding your diagnosis. So, would you like me to continue further with it?
Doctor.
Yes. Uh, as far as we have seen your reports, I am quite happy to tell you that that scan that we ran of your heart, and also the special electrical test of your heart, 24-hour. Actually, both of them were not anything bad. Okay, the scanning was completely normal, and the electrical tracing that we did, it showed that there were some minor problems with your heartbeat. Are you getting me, Miss
No, Doctor,
Scarlett?
you said that there are some minor problem, but
Yeah,
there
yeah,
no abnormal findings
yeah,
on the test
yeah,
results.
yeah,
So
yeah. I'm
why are
coming
they
with
having
that.
this?
Yes, yes, I'm coming to it, Doctor. Miss Scarlett. Actually, as far as we have, we have studied your heart electrical tracing. It's not a severe issue. Many people, we actually call it ventricular ectopy. Have you ever heard of it, Mrs.
No,
Scarlett? Miss Scarlett?
no.
Okay. Well, actually, in many people like you or many other people, sometimes there can be some irregular beating. Okay, sometimes of the heart. Okay, so we can it can be recorded even we do that 24-hour scanning like we did it on you, and we can find it in that time, but it is not anything serious as far as we are concerned. Are you getting me, Miss Scarlett?
Okay, if it is not serious, why am I having these type of symptoms?
Yeah, okay. Actually, many people can have these symptoms that sometimes they can feel some beats. Okay, but as far as we have examined you, and also we have done the scanning tests and tracing, it doesn't show anything harmful at this moment. Okay, are you with me, Miss Scarlett?
Okay, doctor.
uh, well, actually, and you were talking about one of your relatives. Okay, so may I just know that did you know what your relative's diagnosis was, or what about it? Something
No,
about.
no, I don't know.
Okay, okay. But I guess you are concerned about it. Am I right?
Yes, doctor.
Yes, yes. At this moment, as far as long as we have reached the diagnosis, we don't think that it is anything serious like your relatives might have been. Okay, so we don't think that anything special 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 can be needed for you, can be needed for you. And are you getting me, Miss Scarlett?
Okay, doctor. Are you sure that I don't have anything serious?
uh, at this moment we have we have actually examined you and also done the tests. These results have shown that at this moment you do not have anything serious of your heart condition. Okay, but it doesn't um, it doesn't actually omit that you need to have a healthy lifestyle. Okay, you have to maintain all healthy lifestyle like all other people, but you don't need anything special for any special test, any more special test, or any more special treatment for this purpose. Are you with me, Miss Scarlett?
Okay, doctor.
Well, actually, um, can you okay? And do you think that uh, do you need to know anything more about this, or this condition, or anything
Yes,
more?
doctor. Why I am having this? I am asking you that why I am having this. I haven't seen any other people having this type of symptom. Why this is only with me?
Yes, yes, I can get it. Actually, I'm sorry to say, but this can occur actually in many people, and even in very normal people, in people having very normal heart. Okay, so it is nothing, anything what we call as a disease condition. Okay, so I can understand that you are very bothered, but it's actually quite good news that it's not a serious condition. It's Scarlet. Are you getting me?
Okay, doctor. You are saying that it is not a very serious condition. Can you do anything for me? I am really worried, and I am really boring for. It is really boring for me to tolerate this. Is there any medication?
Okay. Actually, for this condition, at this moment, we do not want to burden you with any medication, because actually every medication also has some bad effects. Actually, there is nothing, no medication without bad effects. And as long as, since we have found out that your condition is not cannot be termed as a disease condition, so I think that it's not needed any kind of medication at this moment. uh, are you with me, Miss Scarlett?
Then I will have to live with it.
No, actually, in many patients, this condition, in many person, this condition can actually fade out with time as well. Okay, but yeah, fade out with time as well. But yet again, we will be very careful about you, regarding your concern and everything, and can also do some follow up on you, so that we can later on. Okay, some follow visits to a GP about your complaints, whether you are still having it or not. Okay, are you getting me, Miss Scarlett?
Okay, doctor.
Well, Miss Scarlett, do you think that there are any more concerns that need to be met, or anything?
Okay, doctor. I heard that a test that is called that can see the heart with a special dye test.
Yes, I
The
get it.
heart attack people are undergoing this test. Cannot you do that test for me, just to be sure that I don't have any other problem, any problem with my heart?
Yes, I get it, Miss Scarlett. Actually, what you have heard, that's not wrong. Cannot refute that. But it's also true that no test is without any complications. And at this moment, you are not that test is absolutely not needed for you. And I would also like to add that this type of test, like this dye test, actually, this can uh, actually cause a lot of risk in your life. Okay, these tests are not risk free at all, and they have many risks involved in it itself. So you're not in a condition at this moment to be exposed to that kind of risk. Are you getting me?
Okay, doctor.
Well, Miss Scarlett, may I ask you some questions now? Some personal questions.
Okay.
Do you smoke?
Yes.
May I know how many sticks for how long?
Some one or two sticks per day, especially when I feel stressed.
Okay, actually, smoking can actually actually deteriorate any person's heart. Okay, and it will be very good for you if you stop smoking. And if you need, I might refer you to a smoking cessation clinic. Will that be okay for you?
Okay.
And may I ask you some other questions? That do you drink alcohol?
No.
That's very appreciable. And I would like to ask you one personal question, if you allow. May
Okay.
I ask? Yeah, yeah. Do you take any recreational medication?
No.
Okay, I was very sorry to ask. And do you think that well, have you been under any stress recently or anything like that? Do you think?
No.
Okay, that's all right. And may I just ask you that what do you do for a living?
School teacher.
Okay, and may I ask you that is there condition causing any problem in your job life?
No.
Okay, that's very good. Well, actually, if you
Honest
ever
meaning.
okay, okay, and actually, if you ever feel any problem with your job and anything, you can contact us, and we will try to help you by contacting the occupational services. Okay, occupational health services. Will that be okay with you?
Okay.
And Ms. Scarlett, do you actually? I think we have covered a lot of issues here today. Yet again, can you please tell me that is there anything more that you would like to know about or anything like that?
Ah, doctor, actually, this symptom is very boring for me, and I really get frightened when I have these symptoms. Is it possible to get any second opinion?
Yes, Ms. Scarlett, we are actually always open to our patients' concerns. And if you want a second opinion, we will talk to our consultant and our hospital manager, and we will try our level best to arrange another second opinion. And you can also yourself seek a second opinion as well. Are you with me, Miss Scarlett?
Yes.
Well, do you have any other concerns or any more questions, Miss Scarlett?
No. Thank you, doctor.
Okay, thank you, Miss Scarlett. Okay, thank you.
You are finished, or you want to do any
Just one second.
time up?
Hello.
Yes.
Yeah.
So, can you tell me that what was your task?
Uh, well, my task was actually to make her understand that it was nothing serious, it's benign condition, and uh, there was no further I think further investigations are needed. I think that was the main task here.
Okay, and do you think that you could explain it to the patient well?
I think I tried my best, and I think she understood that. Although she was a bit rigid at the beginning, but later on, I think, got a bit of understanding that it might not be serious. But however, she sought a second opinion, and I think I should allow that second opinion, since it is every patient's right.
Okay. I am going for the history registration for introduction. This was fine. And after introducing yourself, you could have asked that how do you feel now?
I think I asked that, how are you now, or how do you feel now?
Okay, and after that, you could have asked that how what do you know about your condition?
Yeah.
So I could tell that I do not know anything, or I know that I have ventricular ectopic. My GP said that.
Mm, mm,
Okay.
mm,
So you could have asked it before, and after that, I also initially I also tried to express my concern that I am really afraid that my relative have has that I, relative has that heart attack recently, so I am worried. And you are not paying attention to my concern. You were going for your next task.
mm.
You didn't pay any attention to me. That's why I am concerned about that. You could have at this time you could have asked, okay, I can understand that you are much worried for that. And is it okay if I ask you a few more personal question and explain it better? Then I could understand that yes, you are going to find out or you are going to help me with my concern. And initially it came to my mind that you didn't pay attention to my concern. That means you are going to deliver your own news. You are not paying attention to my concern.
Okay, I can get it. But what should have I asked at just at that moment?
Okay. I can I appreciate your concern, or I can understand that why you are worried. But to make it clear, to give you the better explanation, can I ask you few question, or uh, can I proceed with a few queries, and after that I can give you the better explanation, I think.
And what questions should have I asked?
Okay, at that point, that why do you think that you are having heart attack, or why do you think that or
Okay, okay.
why do you think that you're having a heart attack, or why, or what came in your mind? Is there any other family history of heart attack at younger age?
Mm-hmm.
Okay,
Mm,
was there any other
mm,
problem with heart in your family, in the close
mm,
relatives?
mm, mm,
Do you know that what happened to your uncle?
mm, mm,
Is there any
mm,
made any diagnosis or not?
mm.
I've asked this. Or you
Yeah.
could have asked, you could have gone with the normal conversation, just assuring the patient that you are coming to answer the patient's concern later. But you didn't touch anything about the concern at first.
Yeah. I should have. That was the main mistake. I think I asked that haphazardly later on, but
Yes,
I think I should have gone
and
for that just at the beginning when she told it. Am I right?
yes, and also after that, she asked you that why I'm having this. You are not giving the answer in a correct and in a comprehensive manner. You are telling just something that you don't know anything about it, and you are going to tell that you need to tell something. So you are telling this. I
Okay. What should have
didn't,
I told?
I didn't get
Yeah.
any point that why I'm having this. I didn't get any clue or anything uh, that why I'm having this.
Okay.
I couldn't get any
Okay.
answer from.
Yeah.
You could have said that, okay, is it okay if I show you uh, by drawing something? Or,
Mm.
then I could say, okay. Then you could draw the heart and show that what does this ventricular ectopic means. I do not know anything about ventricular ectopy. I even don't know where the heart is. Suppose. So how will I know that what is ventricular ectopic? So you could have explained that okay, this is heart, and the
Okay.
heart generates electrical activity to make it pumping or to make it active.
Okay.
And sometimes in the some part of the heart produce some minor electrical activity, and for that the activity is extra activity happen to the heart, and at that time you feel this type of symptoms. You feel racing and pacing of your heart at that time. And
Mhm.
if it persists for a long time, then we say it is harmful. But we have done your test that how long it persists, and uh, but we find that it is quite a normal. That normal people have this type of activity. It is normal, totally normal activity. It is nothing serious. And also we have scanned your heart that also find there is no abnormality in the structure or in the uh, any part of the heart. So I could get that yes, that I have ventricular ectopic, and what is meant by ventricular ectopic, and it is not harmful for me. I didn't get anything from your explanation. That what do you mean by ventricular ectopic?
Okay, so I actually didn't know how to explain that. So this is been very good. So, okay,
And
this has been very
after that,
helpful.
why I am having this ventricular ectopic? Okay, there most of the case it is unknown, but there
Mm,
are some factors that can increase ventricular ectopic events, like having excessive alcohol, excessive tea, or any anxiety, or taking much alcohol. Man,
mm,
do you have any of those? And even some medication also can. Uh,
mhm,
do
mhm,
you
mhm,
have any of those? Then I could say yes, I take a lot of tea, or I could say no, I do not take any of those.
mhm,
Then you could say okay. Then most of the case, as
mhm,
I said, then most of the case it is not known why people develop this. So in your case, it is likely that you do not have any other problem, just like a normal people. Then I could say, okay,
okay.
am I going to die with as my
Mhm,
relative? Then you could say, okay, in aspect of the heart condition, it is totally
mhm,
normal what is happening with you. So you have
mhm,
this chance of having heart condition as like as a normal people have. You are
mhm,
not any risk from this type of
mhm,
symptom.
mhm, mhm,
Okay,
mhm,
then I could
mhm,
get okay. I I I, I have this. I have the normal symptom, and I am not at
mhm,
risk.
mhm, mhm, mhm,
And also, when telling that my
mhm,
relative diet, then at that point you could say that okay, I do not know
mhm,
what happened to him, and
mhm,
if it is possible, I will go through his note, and will try to find out. But I can
mhm,
assure you that your
mhm,
condition is not going to make you prone to the heart attack.
mhm, mhm, mhm,
Okay. And after that, for the management plan, there are a few management plan
mhm,
I can follow. You haven't given any advice on that. That any I should go for healthy lifestyle management, any relaxation management if I have anxiety, and also I need to make it that it is normal, so I do not I need not to worry for that, so that it could make me relax, make me free. And after that, I have asked about the medication. There are few medication that can help with ventricular ectopy, but the
mhm,
medication also comes with some side effects. So as it is not a harmful
mhm,
condition, and
mhm,
it is not so severe, so I am not we are not going to give any medication for that.
mhm. Okay, okay.
Okay. And
Okay,
after
Mangesh.
that, in the personal history, you have asked
Mhm,
about smoking, alcohol, okay, and
mhm,
also the tea, coffee, etc. The
mhm,
specific drug
mhm, mhm, mhm,
really support
mhm,
if you needs any support at home.
mhm, mhm, mhm.
Okay,
Okay.
Okay, after that, you can give some leaflets, some website address so that she can know better about her condition.
Okay.
And also for the investigations, you are insisting for investigation. Your explanation for the investigation, not going for the next investigation, was fine.
Mm. Mm-hmm. Okay. Okay. So may I ask one question that how much will I get in this type of performance? Can you please tell me?
I do not have any idea.
Because I think I missed a lot of
You missed patient's concern at first, because patient were at first patient told you that I am very much concerned that my relative died from a condition, so am I going to die like him? At that point, you should have been alert that okay, I am going to fall into the trap.
Yeah, okay. That's a very important learning because I just missed that. I asked that later on, but actually I should have started
You
with
could
that.
answer at that point if you knew the answer, but as you didn't know the answer, so you could at least say that okay, I am going to ask you two questions, so I am going to find out that what is happening with you, and also I try to find out about
Yeah, yeah, yeah,
your answer. I try to meet the concern better, but to know you better, to know your condition better, I need to ask you few personal questions. Is it okay with you?
yeah, yeah, yeah. Okay, okay. I think that's all for this case.
Okay.
Okay, and if anybody Tanipu wants to add anything or have any queries,
Otherwise, I am stopping.
okay.